Welcome, friends. Today we are going to have a small discussion on homeopathic remedy Spongia tosta. As we all remember, its common name is roasted sponge and it belongs to animal kingdom and its family is Coleantheriata. This remedy was proved by Dr. Hahnemann himself. And here we are dealing with the current clinical correlation. And as we all remember, that the main text what we are following is Allen's keynote. And this is a very good study for the BHMS students and interns as well as general practitioners. Friends, I am Dr. V.K. Chauhan, homeopathic physician. The part specifically we are going to deal here is the characteristic particular general symptom which is given on the sentence number 3, which we represent here as PQR3. And this is a very small sentence which tells us about swelling and induration of glands, goiter, and corresponding remedy is bromium. So this particular line tells us about induration of glands means it is a characteristic general symptom also, but in particular, when we talk about goiter, it refers only to thyroid gland. And so here we are going to keep ourselves contained with the discussion of thyroid only. So here we can see here swelling and induration of glands, goiter, and here this particular diagrammatic representation presents a young girl having diffuse goiter, diffuse swelling of thyroid gland. So friends, if you try to figure out, the first thing which comes to our mind is it is a diffuse colloid goiter. So what are the causes of diffuse colloid goiter you will get? Generally, it is because of iodine deficiency, and then there are certain foods. If you take these foods, they will not allow the iodine to be absorbed in the body, and some of them they is like we have cabbage, millet, and soya. Endemic areas are there, especially the Himalayan belt is the very common area where you will find many of such people who have thyroid enlargement. And then there is a last condition where we can take it as a physiological, where it is commonly seen in pregnancy and puberty. Well, friends, the clinical features includes there is a diffusely enlarged thyroid gland and it is mostly asymptomatic. But sometimes, if it is chronic and it is very markedly swollen, then you will find pressure symptoms may be like difficulty in swallowing, and if it is going to press upon the recurrent laryngeal nerve, then there can be hoarseness, which is very, very rarely seen. And if you go for the thyroid function, what you will find normal T3, T4, TSH or slightly high TSH. So it is a kind of self-limiting disease, but at the same time you have to ensure that the patient receives the sufficient iodine in his food so the condition will resolve itself. But same time we need to know some other conditions which needs to be differentiated. And second most important condition is acute thyroiditis. And the key features you will come across is it is usually post-viral or viral thyroiditis. Bacterial is maybe present but not so commonly. And there is a sudden painful thyroid enlargement is there. The pain radiates to jaws, ears and throat. There can be fever, malaise, lassitude, body ache. Common features of viral fever will be there. And if you touch the gland, it is tender, it is hot, it is painful. And there can be a transient hyperthyroid phase, because once the swelling takes place in the thyroid hormone gets secreted or dissipated into the circulation. So there is a temporary feature which will show you features of hyperthyroid state. And what are the diagnostic clues we have? Very high ESR you will find, and apart from them you will go for T3, T4. They will be high initially, but if you follow within 10, 15, 20 days, they will come down normally. Well, friends, one more important condition we have to keep in our mind, that is chronic Hashimoto thyroiditis. Let us not confuse with simple colloid goiter, and here the key features are: it is a painless firm lovely gland, and at times you will find it is enlarged, and the cause is autoimmune reason. There is a diffuse enlargement initially because of swelling. This swelling is not very acute swelling. There is no tenderness, there is no heat, there is no fever, but there is a simple, and even the pain may not be present over there, but gland may be diffusely enlarged. However, after some time in a chronic phase, the gland is going to atrophy later on. A hypothyroid state will develop later on. So patient will have, apart from weight gain, cold intolerance and constipation, bradycardia, other symptoms will be there of hypothyroid. But how to diagnose and what is the diagnostic clues? You will find very high TPO antibodies, and you will also find TSH is high, T3, T4 is low. That is the clue for diagnosis. So let me summarize. In one line recall, if you call if you talk about colloid goiter, it is painless, which is because of iodine deficiency, and there is normal function of thyroid, matlab it is euthyroid state, euthyroid state. Acute thyroiditis, it is painful, it is generally post-viral or viral. There is hyperactivity, hyper hyperthyroid state initially, but which is going to subside later on as the patient heals. We go to the Hashimoto thyroiditis. It is a painless autoimmune inflammation which will ultimately lead to hypothyroid state. So please remember that spongia is having many shades, and we have touched here only one small part which is having the action on thyroid gland only. So friends, thank you. Thank you very much for your patient watching, and please remember that sharing is caring. Thank you very much once again.